I know a lot of us already looking forward to and maybe planning out things for the year 2022, right? Well, health insurance, healthcare has to be a huge part of that. Joining us once again, we're always so happy to welcome back MyCare Medical, James Dubrey, breaking things down for us, where people stand. How are you? It's been a busy time of year for you guys in the team.
It has been a great time, very busy, but we're doing very well and we're very happy. Nice to see you, Carly.
So kind of explain the timeline here and what people need to know, because the annual enrollment period has just wrapped up. But now we go into kind of a new phase of this. So first of all, how did annual enrollment go? Kind of what's your thoughts today, James?
Yeah, so fantastic. We had a great AEP. That's the annual enrollment period. That's when folks actually between October and December actually get to make decisions about who they're going to have as a provider for the next 12 months or so. And you know, first of all, let me say thank you for this show. This platform is so wonderful to have trusted journalists that reach a broad audience, allowed us to get a lot of the message out there. And we actually are feeling comfortable that we're saving a lot of lives because of this platform. So we really appreciate it. We've had a lot of people that have come through and visited our clinics and made the choice to join MyCare. And a lot of it has to do with this, hearing this message on this platform. So we had a great period during this period of time. And now we're transitioning from what we call the annual enrollment period, where you actually get to make some selections, as many selections as you want between October 15th and December 7th about providers. And the last provider that you choose is the one that's going to be your provider. Now we go into what's called the open enrollment period, and that lasts from January to about the end of March. And what that does is, let's say for the sake of argument, you selected somebody other than MyCare. You went there and you visited them and you said, you know, I should have trusted my first instinct and joined MyCare. Well, this open enrollment period gives you one last chance to make a decision because sometimes you get buyer's remorse during the annual enrollment period and something happened and you selected the wrong provider. This is your one last chance to make one change, and that's the open enrollment period.
So as we're kind of in this season between the two, what can people do today? What advice do you have for them to make sure? I mean, again, this is probably the most important decisions people are going to make is about their health care.
You're exactly correct. So this is the period of time where you go and you check out every place that you wish you had been able to see. Okay. You actually make phone calls to the provider that's on your card to see how they respond to your calls. You actually go see that provider if you can to see how they actually take care of you in terms of your health care. This is the period of time when you say, did I make the right decision? And if you felt like you didn't, and after you do your investigation, you can make that change one more time.
Why do you think, we probably have about a minute left here, why do you think so many, I mean, you know, MyCare Medical is just growing so rapidly. What do you kind of attribute that success to? And we've had a chance to meet a lot of the doctors, so I obviously can see from that perspective. But what say you, James?
Yeah, you know, I think a couple things that happened this year to make this such a great year for us. One, the abatement of COVID. COVID is starting to wane, not completely, but to a certain extent, it's starting to wane, and more people are wearing their masks. So patients feel a lot more comfortable coming to the provider, and we know standards of care, protocols have been put in place that allow them to come and visit the clinic and feel really comfortable. So that has been a big help. You mentioned it, the strength of our clinicians are just a big draw. We have some of the top-notch clinicians in the county, in the state of Florida for that matter. And we work very hard to keep their credentials up to date, to give them continuous improvement. And we also make sure that the experience in the clinics are fantastic. And I think the other two things that I would think to mention is that we've been expanded rapidly. So the MyCare message has been going out and getting out there. And then what you helped us deliver was the MyCare moment, right? That whole reshaping of the patient experience, that when you come into a clinic, you say, wow, finally I found someone that actually connects with me and wants to take care of me holistically. So it's been a big year for us in terms of that. I wanted to say one last thing, because when we talk about open enrollment period, you know, here is your chance to experience your own MyCare moment. This one last chance. If you didn't make that right decision, you can make it now between January and March 31st. all you have to do is contact us at the number on the screen, and someone will be happy to give you a tour and sign you up for MyCare Medical.
Oh, well, happy holidays. Thank you so much. We know 2022 is going to be a great year for you and the team as well. We look forward to seeing you again then as well, too.
Thank you so much, Carly. Have a great one.